Good morning, everybody. Thank you for joining myself and Kelly Lucas. We work in the Medicare Offerings Department at URL Insurance Group. And today is a really fun topic, how to run a Medicare appointment. If you're new to the business and you're just not sure how to smoothly run an appointment from, A to Z, or you just have some compliance questions or just flow of the process questions, this is the perfect webinar for you. All month, we're doing webinars on Medicare education. Last week, we did a Medicare 101. Next week, we're doing Medicare Advantage versus Medicare Supplement. And then the following week, we're doing a whole webinar on prescription drug plans and how they work and really getting into the weeds with that. If you want to register, you can do that on our events calendar on our website. And you can also watch past webinars on demand because we do record them all, as we will be doing with this one today. On the bottom right of your screen, there's a blue Chat Now button. Please go ahead and push that. There's a place for you to chat to the group, write questions, and we'll get to those as we go. There's also a spot for handouts. We have a lot of handouts for you today, and we'll be going over them throughout the slides, and we're going to do a little screen share today. But before I introduce Kelly and what she's here to do, so she does our internal enrollments when you use Orion Client Services. So she's really familiar with Medicare Now, our platform. She's going to be running you through that whole process. But what I'm going to talk about first is how to prep for your appointments. So first and foremost, we don't want you to be wasting your time. However you're getting that lead, if it's a generic return from a mailer, if it's somebody calling you from a marketing campaign that you've done, I know we can get really excited and we just want to set that appointment and get out there, but make sure that you're qualifying the lead first. A lot of people have been reaching out a year and sometimes even more before they're even ready to enroll into Medicare. And we don't want you to waste your time and have to visit with them several times before you can actually do the enrollment. So make sure that you're qualifying your lead, you're setting expectations, you're giving them good timelines to stick by. They just need that peace of mind to know that they're not being procrastinators or that they're doing everything within a timely manner. So these are some good questions to start out with. Are they turning 65? If they aren't, what's the situation? Are they disabled? Are they on disability? Are they turning 65 in the future? Do they have some kind of qualifying event? What is their current coverage? So are they on group? Are they on COBRA? Are they on Penny? It really helps have a transitional conversation if you know what their current coverage is and how you can best help them. And you kind of then already have a general idea of what you're up against or what kind of plan you're comparing for apples to apples. When is their original Part A and B effective dates? Are they already on A? Do we need a special election for B? Do they need help enrolling in Social Security altogether? Maybe they have nothing. So these are all things that you can help with prior to the appointment to cut down on appointment time. And what's most important to them when purchasing healthcare? If they can't answer that question, they should be thinking about that question for your appointment. And then, do they receive any extra help? Are they on Medicaid? Are they on PACE? Anything that's going to assist with Medicare costs. Things that you can tell them to have ready on appointment day. First, of course, is their Medicare card, because you can't enroll them without their Medicare number. Their driver's license, and that's just to verify spelling and their address. Credible coverage letter if needed. If they're coming off the group plan, you're going to need that to enroll them into a plan. So it's just nice to get it off the bat and not have to go back and get it later or have them search for it. And it usually has termination dates on it, which is really important for effective dates. So it just helps to have it, like I said. Losing group coverage letter showing date, if needed again. Have them prepare a list of doctors. And, every doctor that they see, if it's important to them, if they're seeing a urologist or an oncologist specifically, or any person that they don't want to change, it's important that you're checking networks for those doctors. So a full list of doctors, and then prescriptions with quantities and dosages, obviously, so you can check the formulary and pricing for them. Okay, so before the appointment, changes with CMS this year is the 48-hour rule is back in effect. So you want to make sure that you're getting that scope signed at least 48 hours before the appointment. There are the exceptions of the walk-in, just like it has been in the past. Or I believe if it's like 6 days out from the effective date, you can have it the same day as the appointment as well. Make it clear that you're an independent agent and that you offer multiple insurance plans, but that you don't offer all the plans, and that you do not work for Medicare. So that's really important with compliance. And tell them a little bit about yourself. We're taking a sales course here at URL, and it's really important to make sure that you're building rapport with your clients. You're going to build rapport throughout the sales process, but tell them a little bit about yourself in the beginning. They're going to be sharing a lot of information with you, and it only seems fair to just give them a little insight about yourself. And then explain plan eligibility, enrollment, and disenrollment periods, because that seems to be the questions that we get the most about. Or if there's something that comes up later where your client wasn't clear on a topic, it seems to be those items. And that's what's going to have them reach out to another agent if they're confused. So make sure that those things are clearly spelled out for them. Okay, and this is where it starts with the enrollment process with this handout. So I'm going to let Kelly take over.
Good morning, everyone. So this is a handout that myself and my team like to use a lot when you're meeting with clients. They can also find this in their Medicare Now book if they have that. Some people keep it, some people don't. But this can be very helpful because a lot of times your clients like to see the difference between their options. So we usually get this out, use it if we're going to write some things down for them. So can explain, you have original Medicare and then you have your 2 different avenues. And we like to explain it as they can either have pay now or pay later. And with this being separated the way it is, as you can see here on the screen, to the left-hand side, if you're looking at the Medicare supplement plans and the prescription drugs, that just gives them a picture to look at if they're visual folks, to see what those options look like. And then you can even write, on the sides, what some plan options are, assuming that you have the scope needed first, to make sure that you can move forward with going over that plan information with them. And then on the opposite side is looking at that Medicare Advantage option for them. So it just kind of gives them a nice visual to see that they'll have original Medicare and then they have 2 different options, the way that's splitting down the page, and gives you some room to write on there and go into specific plan detail. And then they can keep that and take that with them. It's just a good reference point for them to use and discuss with you. It gives you that opportunity, as Christy was mentioning, when you're building rapport with them, you're jotting things down for them and for you to keep in mind as you're moving forward in your plan review with them. And then the next thing you want to do is just make sure that you're explaining the difference that obviously everyone's aware. There is no cookie cutter plan, no one size fits all. So it's really important that they understand the difference between a Medicare Advantage and a Medicare supplement plan. What is something that they're looking for that's important to them when you're getting that information from them as well? And it's giving you some questions here that you're thinking about asking. Do they like to travel? What's important for their healthcare? What's in their budget? When we talk about, again, that pay now or pay later, is it the supplement side? Is it an Advantage side? Explaining the premiums and max out of pockets and the difference between both, or maybe the differences distinctly between the 2 is that network piece. So just making sure there's a clear understanding and understanding your client's expectations of what they're looking for as well can be very helpful when helping them navigate through. So what I want to do at this point is just do a screen share with you all and show you our Medicare Now tool. So again, this is when you're looking to enroll your clients in either a Medicare Advantage plan or a Medicare Medicare prescription drug plan. Both of those are what you can use here in Medicare Now. So once you have your account and you're logged in, you would click the new profile, new beneficiary, and you're going to start entering your client's information. So we're obviously just going to do a test here. No one in particular, but you're going to start with their zip code. Any field on here that you can see that has an asterisk, you want to make sure that you're populating those asterisks. Date of birth is not listed as something that you have to have populated, but clearly that's something you're going to need as you're moving forward in the enrollment process. So if that's something that you have at that point in time, you want to go ahead and enter that. Again, you can see email, phone number is not required, but obviously helpful if you're going to be enrolling someone. So you want to make sure that you get all that information from your clients and go ahead and get them enrolled. And address. So when you have a zip code, you start putting in that client's address, it's going to populate what's available in that area. So you don't necessarily need to, type everything out if it's listed here. So we're just going to pick this one here. If they'd have a PO box, a lot of times I put that PO box here in the second address box. Then these fields down here, this can let you put a little bit of some custom comments in here. If there's things that you want to remember about the client or notes, that can be helpful as well. And then you can see the Medicare eligibility section here. So if you know their Medicare number, you can put that in here, as well as their effective dates, save that information, and then you're going to move forward to that next section. Now, again, moving forward, you're going to want to make sure that scope of appointment is done ahead of time. If it would happen to be someone who is coming to see you in person, you can complete that scope of appointment form in person. If you're not familiar with what your clients see when you send them this email, here's what the scope of appointment form looks like to them. So either way, this is what your client's going to get if you're sending it prior to that appointment, because that 48-hour rule, or if they're in person with you. Again, they're going to be clicking those options of what they want to talk about. Their information is going to be populated. Again, those asterisks, any area that you see that asterisk, your client has to make sure that those fields are completed. And then they're going to check that box, continue forward, and then it's going to let you enter your information here as well. If I can type my phone number correctly. Fill out the information the plan information that you need to have here, and so forth. I'm sure most of you, if you're familiar with doing this, know how you're filling out a scope. Check that box, and it's going to save it here. Sorry, will prompt you if you do not have them all the fields filled in. It's then going to save your scope here for you. Again, if you're filling it out in person with them, or if they filled it out prior to you meeting, you will be able to see that scope in here. You can then view that. It will save it here in Medicare Now for you, or you can take it, download it, save it if you use Salesforce or whatever CRM system that you're using, so that it's attached, so you have that to keep on file for those required time frame. From there, you're going to move forward to preferences. So again, as Christy mentioned, this is kind of the section where if you're looking for providers or prescription drugs, that you're going to move forward. So I just click right to prescription drugs, and this is going to start that search for you. Now, one thing, if you remember, I want to say it was about 2 years ago, we introduced to you that blue button feature. So if this individual, your client, has a Medicare.gov account created and they have their medicine cabinet already completed out there, you can send them an email and it will just secure that and upload that for you. If they don't have it, of course, as always, just search those medications, starting with their drug names, milligrams, how many times a day, add them to the medicine cabinet. Trying to think of some common ones here. We'll just put 2 in here and move forward. Once you have that drug list completed, you're going to continue on and you'll add the pharmacy for them. So a lot of individuals like to use mail order. That's fine. They can use mail order. It's just typically asking, if you were to use a retail pharmacy, where would you prefer to fill your medications? You're going to add that pharmacy. If you're not seeing the pharmacy here, go ahead and type that pharmacy name in up there, hit search. It's going to pull in that surrounding area to see what pharmacies are available there. Go ahead and add that pharmacy that they're using. Scroll down here. You're going to click continue and move on to the plan options available for them. This is thinking here. But as it moves on, if you can see in the background as this is thinking, it does then separate your options into the tabs here at the top. So it's automatically defaulting to open on Medicare prescription drug plans. Then you have your Advantage plans. Your MAPD plans, MA only plans, and then prescription drug plans. Supplemental plans you're not seeing in this view. So if we were looking for their Medicare Advantage plan, again, what this is going to do, the way I have it filtered, is to look at the total estimated cost, but you can sort this however you choose to see it, whatever makes most sense for you when you're sitting down with your customers to look. And then also coming down here on the left-hand side, I like to sort on those PPO options. Sure, there may be some clients out there who are fine and happy with an HMO, but that PPO is giving them a little bit of flexibility with their in and out of network. So you can sort this screen to whatever makes most sense for you and your clients when you're looking at your plan options. It's going to go ahead and give you those lists down through, showing you drug costs, monthly premiums, if there's deductibles on the plans, their max out of pockets. If you have an individual who has special needs, you see this little plus button up here, you can add those special need plans in to your options as well. The other thing that I want to show you guys is up here at the top, it says add non-licensed plans. So if you want to be able to show plans that are available, but you may not be able to sell them, that's an option you can click as well, and it's going to add them to that list. Remember when you're talking with your clients, as Chrissy had mentioned previously, you're letting them know you don't work for Medicare and you're selling plans that are available in their area. If you're having that phone call, you do want to make sure in that first first minute of your call that you've read that CMS statement to your clients as well. But once you're in here, you can look through those plan details, go through every benefit option, what's showing in that plan detail with your client, making sure they're understanding any questions, any concerns as you're reading through them. This will let you also link out to, as you scroll down here, sorry, I'm scrolling a little fast. As you scroll down here, you can see the summary of benefits are available, evidence of coverage, star ratings. That's important to make sure you're letting the clients know those star ratings. So you can click that link. It's going to take you out there. It's also going to take you out to the provider directory for the plan carriers as well, that you can search them with your clients there to find those providers. You can go between pharmacies to see if one's showing a standard, one's showing preferred, to show them the difference of what plan options or how their copay structures look. At the top of this, again, you always have tabs. So the tabs that are in the gray are just sitting behind. So once you click on them, it's going to pull that to the front so you can show your client specifically, there's the medications, what tiers are they falling at, make sure they're understanding the tier structure. If they have more costly medications and you see they hit the gap and all of that you're clearly explaining how those work. Again, each medication is going to show you if there's a prior authorization required, if there's quantity limits or step therapy. So make sure that you pay attention to that as well so you can review all that information with the client. This total estimated cost, that's just breaking it down month for month if they want to just see it that way. Again, this is showing by the effective date. So if you're enrolling someone for July 1st, August 1st, you can actually click to that month. So you're giving them a true picture of what their cost estimated could look like for the remainder of the year. Christy, I don't know if you can tell me, does anyone out there have any questions that popped up while we're looking at Medicare Now?
No, but I have a question for you. Do you mind going back to the quote results page and just picking like 2 or 3 carriers and do like a side-by-side and kind of talk people through what your process is in your brain when you're looking at benefits and comparing them for somebody?
Sure.
Thank you.
Absolutely. So if we're looking at PPOs, we have Geisinger popping up here. Now, again, this is going to be important to when you're talking with your clients and looking through that Geisinger network, especially if your client wants to be able to utilize in-network that Geisinger and Danville. Those are specific things I'm always looking at, but we can do up to 3 comparisons at once So I grabbed a Geisinger, United Healthcare, and Humana here. And let's see. So you can go down through that list and you can change it each time as well. So maybe you start with these three, looking at star ratings, looking at what's the drug cost. Well, drug cost across the board here looks like it's 0. So not really anything standing out specifically there. What does their max out of pocket look like? United Healthcare is coming in a little bit lower than the other two. But from there, what do the other benefits look like? Well, again, pretty comparable here when you're looking at their doctor office visits or their specialist copays. So from there, if everything's looking pretty consistent, I'm scrolling down to see what does their inpatient hospital stay look like. Looking at this, that $325 per admission with Geisinger is coming in to be most cost effective, really, even though that max out of pocket is a little higher. If they go into the hospital with United Healthcare, that one's saying $750. So really paying attention to that, as well as, is Part B give back important to the client? Who has that available? You can see that all that information right here in front of you. If you're doing that phone call with the client, obviously you're recording your phone call, but you can send this quote to the client that they could look through. Or if you're doing a Teams or a Zoom meeting with them and sharing your screen, it's helpful for them to see what you're looking through, going through that side-by-side comparison for them, what's covered, what's not. So say your client says, you know what, I would like you to send me that quote so I can look over this. Maybe they want to review it with their spouse or their daughter or someone to help them look at it. You just hit that send quote. You can text or email that quote to them. When you do, what it's going to do is it's going to send them the code. So they're going to get 2 emails. They'll get one that's going to say the code and then to review their quote. So they just need to know that it is case sensitive. So they can either copy it or make sure it's written down exactly as appears. And then they're going to go in and see that quote exactly how you're sending it to them. Maybe they say, you know what, I really want to go with that Geisinger Gold plan. Again, you've reviewed all the needed pieces with them. You can add that right to the cart for them and start the enrollment. It's going to take you through asking you, are you face-to-face with them or is this over the phone? So you select the proper view, because if you're face-to-face, you're just going to go through that whole application, submit everything, and you're done. If you're on the phone with them or you're on Zoom, you want to make sure that you click that pre-fill and it's going to text or email them for that signature. Again, walking them through that whole process is something that's important. And when you send that application to them, it's important to let them know that they're going to get 2 emails. They want to look for that code and the email to view that application to complete it. Do we want to talk a little bit about this start call recording? That is a feature that's available in our Medicare Now system. So if you do not have something else set up to record your calls, you are able to do that here within Medicare Now. So once you click that start recording, it is going to call out for you to the number that you have entered in here. The number that displays is specific to you as the agent. So you can let your client know, here's the phone number that you're going to see pop up to you. You call that beneficiary, you continue on, and your call is recorded and it is stored in here for you as well. Any other questions, Christy? Anything popping up?
Yeah, Lori mentioned about the Part B, like coinsurance when you're on a Medicare Advantage plan. And that's definitely something that you should review when you're comparing Medicare Advantage versus Medicare Supplement with individuals. The Part B of Medicare does have a coinsurance of 20% when you're on a Medicare Advantage plan. And that typically comes into play for durable medical equipment. It used to a lot with diabetic medications, but that's no longer an issue with the new Part D Inflation Reduction Act that we have in place. And you'll also see it if potentially they have, chemotherapy that they have to do. But if you're doing your correct discovery, those are all things that you should find out before you're even having the appointment. And you should be recommending a Medicare Supplement plan over Medicare Advantage.
Yep. And that does show here in the details as well when you're looking through Medicare Now. So if somebody still feels that a supplement is not something that's cost effective for them, that is broken down here in the details as well. But again, also, as I mentioned, down lower is that summary of benefits or explanation of benefits. So if you really need to dig in the evidence of coverage a little bit deeper, you can open that up from here and you could search, control find anything you're looking for, and review what did those costs look like.
Okay, we might have one more question. Oh.
Okay.
What about using this for quotes for supplements? So Matthew, we have a different quoting tool. It's called CSG. That's out on our website for all the Medicare supplement enrollments. Okay, I think we just have a few more slides we wanted to go through with ending the appointment.
Okay, all you.
So just make sure your client has clear understanding of everything. We can't stress that enough with Medicare Supplement versus Medicare Advantage, because if you're not explaining it thoroughly, somebody else is going to. So we want to make sure that somebody's not going to come in after you and take the sale from you, because we are huge believers that a Medicare agent is to educate. We don't want you out there selling one product over another, because every person has a different risk that makes them feel comfortable. I like to compare it to auto insurance because that's my background. You could have your car completely paid off and it could be in 1998 and you still have full coverage on it for some reason. That's that person, so don't evaluate somebody else's risk. They have to do that themselves. All we can do is guide and educate. Show them where to find customer service information. That's on all the forms that Kelly was showing you that you can email over to them. The plan also will mail them, paper documents of all that stuff once they're enrolled. Make sure to alert them that they can expect a post-enrollment phone call from the carrier. You don't want them to be concerned when they receive that call thinking like it's a scam or anything like that. So preparation is key. Make sure that you're leaving your business card, several of them, because that's the best way for you to get new business is by referrals. So please have them tell their friends about their great experience with you. Can you share the screen with the first questions to ask?
Well, and I did see, Christy, there was one question prior to that. Says if we're explaining all plan types, RX options at the appointment, are we checking every box on the scope? Yes. So anything that the client is wanting to review, that they're marking on that. If they want you to review an Advantage plan, a prescription drug plan, Medicare supplements, they should be marking every box on that scope of appointment form, because you can't be reviewing other plan options if you have not had that completed.
Yes. Gloria, I can email you the slides after this. This is going to be recorded, but I'll email them to you so you have them, so you have those questions. And just make sure, again, after the appointment, that you're saving your application for 10 years, that you're submitting everything that you need to on the carrier's compliance. Some are 24 hours, some are 48 hours. If you're not doing it electronically through Medicare Now, if it's through Medicare Now, you don't have to fax anything. I think there might be one carrier that still requires you to send the scope, but everybody else just, you retain it in your own filing system, whatever that may be. If you have it in Medicare Now, it will be available to you for that whole 10 years. It's not going to go anywhere. You don't have to make sure you download it. The only thing you need to make sure you download for your file is the application. Medicare Now year over year does not save the application, only the scope. Okay. And follow up with your client at least twice a year, and that is just for good retention practices. We recommend send out cards. It's a great way to get in front of people either for birthdays or holidays, super easy, and definitely a pre-AEP letter. They're going to get so much information right before AEP, and you want to make sure they remember to come to you if they have any questions. And we have a lot of appointment handouts today. So if you want to click on the handouts section, you can take a look at those. Kelly referenced how her team uses the quick look at Medicare that has the 2 columns for Medicare Supplement versus Medicare Advantage. So that handout's in there for you. Karen McDaniel, our Director of Compliance, made a secret shopper checklist. Kelly went through a lot of the compliance checklists today. telling you to make sure to do this and that. This checklist is nice because you can actually check it as you go down the appointment and keep it in your appointment file or give it to the individual so they know that you covered that topic. It's just another way to keep you safe. There's a generic scope in there. Since we're back to the 48-hour rule, we just wanted to provide that for you. A customizable permission to contact form, so you can put your agency information in there. It is an editable PDF. And we have a cross-selling form in there as well. So Matt Alina from our life insurance division created this form. If you're an agent out there that sells more than just Medicare, you're not able to talk about those additional policies during your appointment, but you can see if there's opportunity and follow up later. So that's what that form is doing for you.
And if there is an opportunity and it's not a product that you're writing, you can use my team. We would be more than happy to do, work through the referral program with you as well. So if anyone has questions about that, you can feel free to reach out to me and we can talk about that a little further. But one other side note, I'd like to just piggyback on what Christy was saying about. So yes, we go through all this information with clients, make sure they're understanding their Medicare and they have a good knowledge base of the decision they're making. But it's also important, that rapport that Christy mentioned, make sure that you get to know your clients as well, because they're people also. So that's important in building that relationship with them and to keep them coming back and referring their friends and family to you as well.
Exactly. Thank you so much. Okay, we appreciate everybody for joining us today. Again, this was recorded. You can find it on our website on the events calendar. And if you have any additional questions to follow up with Kelly or I, feel free to reach out to us directly. Thanks, everyone.
Thanks.